And the White House is still pushing for this health care vote, but a lot of it comes down to whether pre-existing conditions would still be covered. And I didn't really get necessarily a straight answer out of Republican Congressman Mike Kelly on what role the states would play defining what is exactly pre-existing conditions. Take a look.
Pre-existing is one of those things that I have been on since day one, but it still comes down to the business model of insurance and how do you construct it, and then what is the state's role in this, because we really do believe the states should have some sovereignty. They should be able to put together what they think is best for the people.
But what if my state says no to coverage for pre-existing conditions?
There's a lot of people that feel that's up to the states to decide.
Well, that's an important distinction. If the states then can all of a sudden say you, because you've had a prior condition, you might not get coverage through us, or it might not be as generous, could that be a problem? And for Republicans, could that chase away moderate Republicans who up to now have been open to some of the changes they've seen out of conservative members in their own party? Reaction now from House Freedom Caucus Member Congressman Jody Hice. All right, Congressman, what do you make of that? Because I'm a little confused. Do you stand by, do Republicans still stand by coverage for pre-existing conditions?
Yes, that issue has been resolved. I think the American people have spoken. We want to stand for pre-existing conditions. I think a lot of people get confused between the state's ability to waive out of some of the Obamacare mandates. They confuse that with somehow pre-existing conditions being taken away. They're two totally different things. If a state opts out of the mandates from Obamacare, they must still provide for pre-existing conditions in their state. So there are filters in here. Individuals with pre-existing conditions are going to be protected.
All right, but would it vary from state to state? In other words, could a state then decide where this pre-existing condition is different than another pre-existing condition? That's where I was confused with Congressman Kelly, because it didn't sound like there was a consistent read on that, and that some states might interpret that differently.
Well, I mean, certainly we want states to be able to be states, rather than to have everything come down from the federal government. So to some extent, certainly there will be some variation from one state to the next. But at the end of the day,
but it really shouldn't vary, right, Congressman? With Virginia, how it defines a pre-existing condition and how my state of New Jersey defines it, they should both be on the same page, at least when it comes to that kind of stuff, right?
Well, and they will be on the same page so far as they will still be required to show that they are going to be covering people with pre-existing conditions. Now, some of the details as to how that plays out from one state to the other may vary somewhat, but people with pre-existing conditions will absolutely be covered, and the states are going to be required to do so.
Now, the president, kind of jawboned a little bit at this event with the Air Force Academy at the Rose Garden with some of the congressmen and women who were there, that we're going to get a health care vote, right, guys? And I'm paraphrasing here, but in other words, he's applying the not-so-subtle pressure here to get a vote soon, to move this to the Senate soon, or he's not going to be a happy camper. What do you make of that?
Yeah, absolutely. We all want to take care of this health care issue soon, and the sooner the better. That's what the American people sent us here to do. And the longer we drag our feet on it, the worse it is for everyone. Obamacare is absolutely a disaster. We all know that. I'm not on the whip team, but we are being told that we're very, very close to being able to have the numbers. And I think we're going to be able to get it across the finish line.
When do you think that'll happen?
Hopefully this week. If not this week, I think we're within days rather than weeks. I feel very, very confident about that.
It sounds like the battle is going to be in the Senate, though, that if you get a squeaker and it passes in the House or get the 216 votes, presumably that's what you got to get, that the real battle could be in the Senate.
And what's new about that? I mean, we're all getting tired of the Senate making all of us dysfunctional. It's time that they get their act together and get the ball across the finish line on their side as well.
All right. Congressman, thank you for taking the time.
Thank you very much. Appreciate you having me.